Travelers' phones pose potential risks to public health and biosecurity. In an increasingly interconnected world, the smartphone has become an essential travel companion. However, as travelers move across borders, their devices carry not only personal data but also potential health risks. This article explores the ways in which travelers' phones can pose risks to public health and biosecurity, highlighting concerns related to data privacy, the transmission of infectious diseases, and the potential for introducing invasive species. Researchers at Bond University say the data builds a case that international travelers' phones should be decontaminated at ports of entry to protect native plants and animals, agriculture, and public health. For the study, published in Infection, Disease and Health, researchers swabbed 20 phones belonging to attendees at a World Conference for Doctors in Sydney in 2023. The samples underwent DNA analysis that revealed 2,204 microbes on the devices, including 882 bacteria, 1,229 viruses, 88 fungi, and 5 single-celled protists. Among the microbes present on the surface of the mobile phones were antibiotic-resistant bacteria including Staphylococcus aureus, known for causing infections in hospitals, and Panthea stuarti, which affects crops and can also cause septicemia in rare native Australian parrots. Researchers in molecular genetics say, although the sample size of
Nana Joy knows what to do. Jeff may think he lives in a bubble, but the rest of us don't. Biosecurity is everyone's responsibility. It affects what we eat, how we earn our living, and what we do. Nana Joy knows what to do. Jeff may think he lives in a bubble, but the rest of us don't. Biosecurity is everyone's responsibility. It affects what we eat, how we earn our living, and what we do.
Infections and resistance genes with modern transport. This surely can complicate efforts to control and treat infectious diseases and contribute to the global issue of antimicrobial resistance. Globally, there were almost 5 million deaths associated with bacterial antimicrobial resistance in 2019, and the UN expects this to rise to 10 million deaths in 2050. Australian native plants and agricultural crops are also at risk. A fungus detected on one phone, Fusarium solani, is similar to Fusarium uwalasseri, which is associated with the polyphagous shot hole borer, first found in Australia 3 years ago and spreading in Western Australia. The borers have a symbiotic relationship with the fungi and can kill a tree in 2 years, raising fears native forests and agricultural crops could be wiped out in Australia. There is a clear argument to be made that international travelers' phones should be decontaminated upon arrival to Australia, in addition to existing biosecurity measures. Mobile phones act as contaminated mobile petri dishes, yet they are crossing borders without scrutiny. Protecting our biodiversity and reducing the spread of superbugs is critical not only for the economy but for our national security. By extrapolating the results out to account for 6.8 million arrivals into Australia between January and October 2023, the study's authors estimate 749.2 million microbes may have been introduced to Australia in 2022 via mobile phones. Not all these microbes are harmful, of course, but the odds that pathogenic microbes may find a potential pathway of entry into Australia is high with millions of visitors. The phones in the study were volunteered by attendees at the World Organization of Family Doctors, WONCA, World Conference. The phone owners hailed from North and South America, Europe, Southern Africa, the Middle East, Upper and Lower Asia, Southeast Asia, Australia, and Oceania. The role of smartphones in global travel. Smartphones have revolutionized the way people travel. They facilitate navigation, accommodation bookings, communication, and access to vital information. However, these devices can also inadvertently become vectors for health risks. With millions of travelers globally, the sheer volume of smartphones crossing borders raises concerns about what these devices may harbor. Data privacy and health information. One of the primary risks associated with travelers' phones is the storage and transmission of sensitive health information. Many health-related apps track users' medical histories, vaccination statuses, and even location data. In an era where cyber threats are prevalent, this information can be vulnerable to breaches. If a traveler's phone is hacked, the exposure of sensitive data can have serious implications for public health, especially if it involves infectious diseases. For example, if a traveler carrying a contagious virus visits a destination and their health data is compromised, public health officials may struggle to track outbreaks effectively. Moreover, travelers might not be fully aware of how their data is used or shared, potentially leading to breaches of privacy that can endanger public trust in health systems. The spread of infectious diseases. Another significant concern is the potential for smartphones to facilitate the spread of infectious diseases. A study from the Journal of Travel Medicine highlights that the surfaces of smartphones can harbor pathogens, including bacteria and viruses. Travelers often use their phones in various public settings, increasing the likelihood of contamination. For example, during the COVID-19 pandemic, studies showed that smartphones could retain the virus, contributing to transmission risks. Travelers using public transport, visiting crowded places, or engaging in activities where hygiene practices are lax can easily transfer pathogens from their devices to their hands and then to others. To mitigate this,
billion mobile phone subscriptions, 6.7 billion are held in low and middle income countries. mHealth, using mobile technologies for healthcare, has the potential to transform healthcare in these countries, especially in rural and hard-to-reach communities. Billion mobile phone subscriptions, 6.7 billion are held in low and middle income countries. mHealth, using mobile technologies for healthcare, has the potential to transform healthcare in these countries, especially in rural and hard-to-reach communities.
Of their surroundings. If these devices come into contact with contaminated soil or plants, they may inadvertently carry invasive species seeds, spores, or pathogens back to their home environments. Once introduced, invasive species can disrupt local ecosystems, leading to economic and ecological damage. The smartphone, as a conduit for these species, poses a unique challenge for biosecurity. Public awareness campaigns aimed at educating travelers about the risks of invasive species and the importance of cleaning outdoor gear, including smartphones, are essential in mitigating this issue. As the world becomes more interconnected, the risks associated with travelers' smartphones cannot be overlooked. From data privacy concerns to the spread of infectious diseases and...
Nana Joy knows what to do. Jeff may think he lives in a bubble, but the rest of us don't. Biosecurity is everyone's responsibility. It affects what we eat, how we earn our living, and what we do.
And increased awareness about the role of smartphones in facilitating the spread of invasive species. By recognizing and mitigating these potential threats, travelers can enjoy their journeys while contributing to the health and safety of their communities. Recommendations. Public awareness campaigns. Governments and health organizations should launch campaigns to educate travelers on the importance of smartphone hygiene, emphasizing regular cleaning and disinfecting. Data protection policies. Travelers should be encouraged to understand the data policies of health-related apps they use. Developers must prioritize robust security measures to protect users' sensitive health information. Biosecurity education. Tourists should be informed about the risks of invasive species and trained on how to clean their devices after outdoor activities. Research and monitoring. Continued research is needed to understand the extent to which smartphones contribute to public health and biosecurity risks, informing better policies and practices in the future. By taking these proactive steps, the risks associated with travelers' smartphones can be minimized, ensuring safer journeys for everyone.